Ventilator-associated or induced lung injury. Does the name matter? Point and counterpoint. Published in the Journal of Mechanical Ventilation, September 2024. Key points, terminology and its impact. Ventilator-associated lung injury refers to lung injuries associated with mechanical ventilation, emphasizing a more complex relationship between mechanical ventilation and lung injury, often considering pre-existing conditions and indirect causes. Ventilator-induced lung injury suggests a direct causative link where mechanical ventilation directly induces lung injury, focusing on the physical forces from the ventilator as the main culprit. Arguments for ventilator-associated lung injury. Advocates for the term associated argue that it better reflects the statistical and epidemiological association between mechanical ventilation and lung injury. It accounts for multifactorial elements, including ventilator settings and patient-specific factors. Evidence from studies suggests that terms like VALI, initially adopted during the International Consensus on Critical Care Medicine, are widely recognized. VALI emphasizes the association rather than a direct cause. Arguments for ventilator-induced lung injury. Supporters of the term induced believe that it more accurately describes the mechanical and pathological changes directly caused by the ventilator, such as barotrauma, volutrauma, and biotrauma. Villa highlights the role of mechanical forces like excessive airway pressures, alveolar overdistension, and the inflammatory responses triggered by ventilation. Clinical implications. The choice of terminology affects how clinicians approach lung protection strategies. For Villa, the focus is on optimizing ventilator settings to minimize direct mechanical damage. VALI, on the other hand, considers managing both ventilation and underlying conditions. Accurate terminology helps in research, communication, and clinical practice, allowing for more precise interventions. Pathophysiological mechanisms. Both terms are associated with various forms of lung injury such as barotrauma, volutrauma, and biotrauma, but induced emphasizes that these are directly induced by ventilation, whereas associated suggests a broader interaction with the disease process. Conclusion. The debate is unresolved, with some experts favoring ventilator-induced lung injury for its clarity and precision in describing a direct injury mechanism, while others argue that ventilator-associated lung injury better captures the complexity of the